Welcome back. February is Heart Health Month. Dr. Zachary Iljovaneh with TriStar Centennial Medical Center joins me now. Thanks for being here.
Thank you for having me.
So this is a very important topic, but tell us why. Why does heart health matter?
Well, heart disease continues to be the #1 killer of Americans. For better or for worse, it's also one of the best studied things in medicine. And so prevention is worth the most. And I think that there are a lot of things that we can do to prevent as well as treat.
So every day, what can we be doing to make sure we are taking those preventative steps?
It can be things as easy as getting out for a walk, any kind of activity. You don't have to train for a marathon. You don't have to become a power lifter. I think being thoughtful about our diets and watching things like sodium, not just what you're putting on with a salt shaker, but what comes in the packaging, especially in processed foods. And I think being aware that this is something that it's good to have a checkup every once in a while.
Sure, just being mindful. A daily walk wouldn't hurt as well.
That's right.
Perfect. If we are expecting or suspecting some warning signs, which ones should we definitely not ignore?
The classic things are things like chest pain or chest heaviness or pressure that doesn't go away, pain or discomfort that radiates down an arm or into the jaw or through to the back. I think it's really important to think about some atypical symptoms, though, and especially in certain folks, women being one that we know now is different than what all the textbooks used to say. Things like indigestion that doesn't go away or respond to food. Those are things that I wouldn't wait on and wouldn't want to ignore.
Okay. Now, who should be listening right now? Does this impact everyone? Is there a certain demographic that needs to pay closer attention?
Well, I'm obviously a biased party, so I think everybody should be thoughtful about their heart health, but especially folks who are getting a little bit older, but it's never too early to start being thoughtful about prevention. We know that people that have diabetes have a higher risk of heart disease as well. Again, anytime there's a question or concern, it's not the wrong thing to get checked out.
Okay, perfect. So again, this is Heart Month. What is your overall message to those who are home now watching?
Listen to your body, and we would be happy to help if you need something or put your mind at ease.
Why did you decide to go into this? Why are you so passionate about helping others, especially with their heart health?
I always wanted to help people. I thought that I was told I was good at science, so I guess that's something. But this was a way to really make an impact, and with heart disease being kind of the biggest factor in the United States that's contributing to deaths of Americans, I think that we really need to be thoughtful of this, and I'm passionate about that.
Well, thank you for coming in and for sharing that message with us so we can all be more mindful with the days ahead, especially this month for Heart Month. So appreciate your time.
Thank you very much.